I want you to imagine waking up tomorrow morning and not feeling that familiar tightness in your lower back the moment your feet hit the floor. No stiffness, no that slow, painful shuffle to the bathroom. No grabbing the wall or the bedpost just to steady yourself while your back warms up. Imagine bending down to pick something up off the floor and not dreading it. Imagine sitting through dinner with your family without shifting in your seat every 3 minutes, trying to find a position that does not hurt. That version of your life is not as far away as you think. And the path to it does not run through a pain clinic, an expensive therapy center, or a cabinet full of medications. It runs through 4 specific movements that take less than 15 minutes a day that you can do right in your own home, and that are specifically designed for the way a senior adult's spine and surrounding muscles actually works. Stay right here, because what I am about to show you and explain to you today could genuinely be the turning point you have been waiting for. Welcome. If you are new to this channel, my name is Dr. Alex Morgan, and this is the Aging Wellness Lab, a place where we take the science of how the human body ages and turn it into real practical tools you can use every single day. We cover everything from pain management and mobility to sleep, metabolism, and brain health. If that sounds like what you need more of in your life, go ahead and subscribe right now and give this video a like. We put a lot of work into every single piece of content on this channel, and hitting that subscribe button is the best way to make sure you never miss what comes next. Now let's get into this, because your back deserves some real attention today. Here's the first thing I want to establish, and this is the foundation of everything else we are going to talk about. Lower back pain in seniors is almost never just a back problem. That is the misconception that keeps millions of people trapped in pain cycles that never fully resolve. They go to the doctor, they get told they have arthritis or disc degeneration or mild stenosis, they are handed a prescription or sent to physical therapy for a few weeks, and then they are sent home. And the pain comes back, sometimes immediately, sometimes after a few months. And the reason it keeps coming back is that nobody addressed the actual system that was failing, the interconnected web of muscles, tendons, fascia, and neurological patterns that collectively support the lumbar spine. Your lower back, the lumbar region, is essentially a bridge. It connects your upper body to your lower body. It transfers force from your legs to your core, from your core to your arms, and back again with every movement you make. For that bridge to stay stable and pain-free, it needs to be supported from multiple directions simultaneously. It needs the muscles of the core, not just the abs, but the deep stabilizing muscles that wrap around your spine like a corset to be functional and engaged. It needs the hip flexors to be flexible enough not to pull the pelvis forward and compress the lumbar vertebrae. It needs the glutes and hamstrings to be strong enough to absorb the load of movement so the spine does not have to. And it needs the thoracic spine, the middle and upper back, to be mobile enough to distribute movement across multiple segments rather than forcing the lower back to compensate for everything. When any one of these components fails, and as we age, multiple components often start to slip simultaneously, the lower back bears the excess load. The joints compress, the muscles go into protective spasm, the nerves get irritated, and the cycle of pain, guarding, weakness, and more pain begins. This is why generic stretching advice rarely works. Touching your toes is not a strategy. Lying on a heating pad is not a strategy. What actually works is systematically addressing each of the components that support the lumbar spine in the right order with movements that are appropriate for where a senior adult's body actually is, not where a 25-year-old athlete's body is. The 4 exercises I'm going to walk you through today are not random. They were selected based on a clear logic. The first targets the deep spinal stabilizers. The second addresses hip flexor tightness and pelvic tilt. The third rebuilds glute strength, which is one of the most underrated elements of back health. And the fourth improves thoracic mobility, so your entire spine can move as a unit, rather than forcing your lower back to do everyone else's job. Together, these 4 movements create a daily practice that addresses the full system, not just the symptom. Let's start with the first exercise, and I want you to pay close attention here because this one looks deceptively simple, but it is one of the most important movements in all of spinal rehabilitation. It is called the dead bug, and the name is deliberately funny, but the mechanism behind it is anything but trivial. Here's how it works. You lie on your back on a comfortable surface. Your bed, a yoga mat, a carpet, whatever is accessible and safe for you. You bend both knees and bring them up so your hips and knees are both at 90-degree angles, feet lifted off the floor. You extend your arms straight up toward the ceiling, directly over your chest. This is your starting position. Now here is the movement. You slowly lower your right arm back toward the floor behind your head while simultaneously straightening and lowering your left leg toward the floor in front of you. You move both limbs slowly, with control, and you stop before either one touches the floor. Then you return both to the starting position and repeat on the opposite side. Left arm back, right leg forward. That is 1 repetition. You aim for 8 to 10 repetitions per side, moving slowly and with full control throughout. What makes this exercise so powerful for lower back pain is the specific demand it places on your deep core stabilizers, particularly the transverse abdominis and the multifidus, which is the deepest layer of spinal muscle that runs along the vertebrae themselves. When you move opposite limbs simultaneously, your brain has to fire the deep stabilizers to prevent your lower back from arching off the floor. The goal is to keep your lumbar spine pressed gently but firmly into the floor throughout the entire movement. If your back arches up as you lower your limbs, your range of motion is too big. Shorten it until you can maintain that contact. This is the key point. The movement is not about how far your limbs go. It is about keeping the spine stable while the limbs move. That is precisely the skill your lower back has lost, and this exercise rebuilds it systematically. Multiple physical therapy programs for chronic lower back pain use the dead bug as a foundational exercise because it trains the spine in a safe, unloaded position while still creating significant neuromuscular demand. The research supports it clearly. People who consistently train deep core stability, not just the superficial abs, but the deep muscles that actually stabilize the vertebrae, experience measurable reductions in both the frequency and intensity of lower back pain episodes. The second exercise is called the 90-90 hip flexor stretch, and this one targets one of the most chronically tight muscle groups in the adult body, the hip flexors. The iliopsoas, which is the primary hip flexor, runs from the front of your lumbar vertebrae through your pelvis and connects to the top of your femur. Its job is to bring your thigh toward your chest. But here's the problem. When you sit for extended periods, which most of us do, this muscle stays in a shortened position for hours at a time. Over months and years of predominantly sedentary life, it adapts to that shortened position. It gets tight. And when a tight iliopsoas pulls on the front of your lumbar vertebrae, it creates an anterior pelvic tilt. The pelvis tips forward, the lumbar curve increases, and the joints in the back of your spine get compressed and irritated. This is one of the most common structural causes of chronic lower back pain in older adults, and it is almost entirely addressable through consistent stretching. Here is how you do the 90-90 stretch safely. You start by kneeling on one knee on a soft surface. A folded blanket works well to protect the knee. Your front foot is flat on the floor, your front knee is bent at 90 degrees, your back knee is on the floor, your back hip is extended. This is a half-kneeling position. Now, without arching your lower back, and this is important, you gently shift your hips forward until you feel a stretch in the front of the hip of the kneeling leg. You are not leaning your upper body forward. You are driving your hips forward while keeping your torso upright. Hold that position for 30 to 45 seconds, breathing normally, allowing the hip flexor to gradually release. Then switch sides. If getting down to the floor is difficult, this same stretch can be modified using a sturdy chair. Place one foot on the chair in front of you, step your other foot back into a long stance, and gently shift your hips forward. The mechanics are identical. You are lengthening the hip flexor of the back leg. The floor version is slightly more effective, but the chair version is valid and safe. Here's what I want you to understand about this stretch. The relief that many people feel in their lower back after just a few weeks of consistent hip flexor stretching can be remarkable. Not because anything structurally changed in the spine itself, but because the anterior pull on the lumbar vertebrae was reduced. The joints decompressed slightly. The muscles in the back of the spine stopped having to fight against the constant forward pull of a tight iliopsoas. Pain that had been present for years can begin to diminish, simply because you consistently address the upstream mechanical problem. The third exercise is one that many seniors have never been told is directly connected to their back pain, and that is the glute bridge. The gluteus maximus is the largest muscle in the human body, and it is also one of the most commonly underactivated. Sitting for prolonged periods causes a phenomenon sometimes called gluteal amnesia. The neural pathway between your brain and your glutes becomes sluggish from disuse. Your brain literally gets worse at firing your glutes on demand. And when your glutes are not doing their job, and which is to extend the hip and absorb the load of movement, the lower back compensates. The paraspinal muscles, which are designed for stabilizing the spine, start being recruited for tasks they were never meant to handle. They fatigue, they spasm, they hurt. Rebuilding glute strength and glute activation is one of the most consistently effective interventions in lower back pain rehabilitation, and the glute bridge is the safest, most accessible entry point for a senior adult. Here's how you do it. Lie on your back with your knees bent and your feet flat on the floor, hip width apart. Your arms are relaxed at your sides. Before you move, squeeze your glutes. Actually contract them deliberately. And then push through your heels to lift your hips off the floor. You rise until your body forms a straight line from your shoulders to your knees. Hold the top position for 2 to 3 seconds, squeezing your glutes at the top, and then slowly lower back down. That is one repetition. You work toward 10 to 15 repetitions, focusing on the squeeze at the top of every single rep. The most common mistake people make with this exercise is using their lower back to lift instead of their glutes. If you feel this exercise primarily in your lower back rather than in your hips and glutes, your glute activation is weak, which is exactly why you are doing the exercise. Reduce the range of motion. Consciously think about squeezing your glutes first before you lift, and let the movement be driven from the hips. Over days and weeks of practice, the neural connection between your brain and your glutes will strengthen. The movement will start to feel more natural, and the load that has been sitting on your lower back will gradually redistribute where it belongs. At Dr. Alex Morgan, Aging Wellness Lab, we talk a lot about what we call the kinetic chain. The idea that every part of your musculoskeletal system influences every other part. Your feet influence your knees influence your hips influence your lower back influences your thoracic spine and shoulders. When you strengthen your glutes, you are not just helping your hips, you are rebalancing the entire lower kinetic chain in a way that takes pressure off your lumbar spine. This is systems level thinking applied to pain relief, and it works. The fourth and final exercise is one that most back pain programs overlook almost entirely: thoracic rotation. The thoracic spine, which is the middle section of your spine between your neck and your lower back, is designed to rotate. It has significantly more rotational capacity than the lumbar spine, which is designed primarily for flexion and extension, not rotation. But when the thoracic spine gets stiff, which it does when we spend years hunched over desks, steering wheels, phones, and kitchen counters, it loses its rotational range. And when you need to twist your body to look over your shoulder, reach for something, or simply turn to talk to someone, the rotation has to come from somewhere. And it comes from the lower back, and which is not designed for it, which gets irritated and inflamed from being asked to do it repeatedly. Restoring thoracic rotation is one of the most underutilized strategies for lower back pain relief, and the exercise for it is simple and can be done lying down. You lie on your side with your hips and knees bent to roughly 90 degrees, the same position you might sleep in. Your hands are together, extended out in front of you at shoulder height. Keeping your knees stacked and your hips still, you slowly rotate your top arm upward and over to the opposite side, following it with your eyes, opening your chest toward the ceiling. You breathe out as you open. You hold the open position for 2 to 3 breaths, then slowly bring your arm back. You do 8 to 10 repetitions per side, and then you flip over and repeat on the other side. What you are doing with this movement is asking your thoracic spine to reclaim its natural range of motion. In the beginning, the rotation may feel tight and restricted. Over days and weeks of consistent practice, you will begin to feel the movement become freer, smoother, more natural. And as the thoracic spine regains its mobility, the demand on the lumbar spine for rotational compensation decreases. This is another example of addressing the cause rather than the symptom, and the payoff is significant. Now let me talk about how to use these 4 exercises together as a daily practice, because the sequencing matters. Start with the dead bug. This primes your deep stabilizers and warms up the neuromuscular system. Follow it with the hip flexor stretch. This begins to release the anterior tension on your lumbar spine. Move into the glute bridge. This reinforces posterior chain strength while the hip flexors are warm and elongated. Finish with thoracic rotation. This caps the session by improving global spinal mobility. The entire sequence takes between 12 and 15 minutes, every day, not 3 times a week, every day, because consistency over time is what creates structural change in the muscular and connective tissue system surrounding your spine. I want to be honest with you about expectations here, because I believe in giving people real information rather than telling them what they want to hear. Some people will notice improvement within the first week. Others will take 3 to 4 weeks before the changes become clearly noticeable. If you have had chronic lower back pain for years or decades, the habits and imbalances that created that pain did not develop overnight, and they will not fully resolve overnight. But if you commit to this daily practice consistently, the trajectory of your pain, its frequency, its intensity, its impact on your daily life will change. Multiple clinical studies on exercise-based interventions for chronic lower back pain in older adults show that consistent, targeted movement is more effective than passive treatments alone, and the effects are durable in a way that medication simply is not. There are a few additional habits worth mentioning here because they support what these exercises are doing. First, heat before the exercises. A warm shower or a heating pad on your lower back for 10 minutes before you start improves tissue elasticity and makes the movements more effective. Second, sleep position matters. If you sleep on your side, placing a pillow between your knees reduces the rotational strain on your lower back during sleep. If you sleep on your back, a pillow under your knees reduces the arch in your lumbar spine. Third, hydration. The discs between your vertebrae are largely made of water. They rehydrate overnight through a process called imbibition, but only if your body has adequate fluid available. Staying properly hydrated is one of the simplest and most overlooked elements of spinal health. I also want to address something that many seniors deal with that makes them hesitant to exercise: the fear of making pain worse. This is completely understandable. When you are in pain, the instinct is to protect, to rest, to avoid movement. But here is what the research tells us clearly. In the absence of an acute injury or a structural emergency, like a fracture or nerve compression causing weakness, movement is medicine for the lower back. Prolonged rest actually weakens the muscles that support the spine, increases joint stiffness, and worsens the pain cycle over time. The 4 exercises in today's session are designed specifically to be gentle, controlled, and appropriate for senior bodies. There should be mild exertion and perhaps some gentle muscle awareness, but if any movement causes sharp, shooting, or worsening pain, stop and consult your physician before continuing. Here at Dr. Alex Morgan, Sanjest Aging Wellness Lab, we hear from people constantly who say that they wish someone had given them this information years earlier, that they spent years going from treatment to treatment, spending money on things that provided temporary relief at best, never understanding why the pain kept coming back. If that is your story, I want you to know it is not too late. Your muscles still respond to training. Your nervous system still adapts to new movement patterns. Your connective tissue still remodels in response to consistent, appropriate stimulus. The biology of recovery does not disappear with age. It just requires a smarter, more targeted approach. Before I let you go today, I want to ask you for something, and I mean this sincerely. If this video gave you something real, a new way of understanding your back pain, a practical routine you can actually start tonight, please share it with someone who needs it. Share it with a parent, a sibling, a neighbor, a friend who has been suffering with back pain and feels like there is no good answer. Because there are so many people who do not know that real sustainable relief from lower back pain is available through something as accessible as a 15-minute daily movement practice. You sharing this video might be exactly what they needed to hear today. And drop a comment below and tell me, how long have you been dealing with lower back pain? Have you tried exercises before, and what happened? Or if you are going to start this routine today, tell me that too. Your comments help build this community, and they help me understand what to cover next so I can keep bringing you content that actually makes a difference in your daily life. Subscribe if you have not already, and I will see you in the next one, where we will keep going deeper into everything your body needs to feel strong, capable, and pain-free for the years ahead.